Continuing the important questions from blood physiology. How does intravascular erythropoiesis differ from extravascular erythropoiesis? Development of RBC is called erythropoiesis. During intrauterine life, there will be three stages of development. Mesoblastic stage up to 3 months from mesoderm of yolk sac, intravascular erythropoiesis. Hepatic stage after 3 months from liver and spleen. Myeloid stage after middle of the fetal life from the bone marrow. Stage 2 and 3 are called extravascular erythropoiesis. How do red bone marrow differ from yellow bone marrow? That you will be learning in table 8.2 page 67. Give the stages of erythropoiesis with the duration. What are the main characteristic features during the development of an RBC? Terminologies and the special features and the characteristic feature. First will be hemocytoblast, proerythroblast, early normoblast, intermediate normoblast and late normoblast, reticulocyte and erythrocyte. This will be 7 days and then this will be 2 days it takes place. Mitosis will be present in hemocytoblast, which is a stem cell. In proerythroblast, they are actively mitosis will take place. In early normoblast, also active mitosis will take place. Intermediate normoblast, hemoglobin starts appearing. Late normoblast, mitosis will stop. In reticulocyte, these are juvenile RBC. No nucleus will be there. Remnant of RNA will be there. And the characteristic features of hemocytoblast: as the cell attains maturity, all the characteristic features, size of the cell will be decreases and the cytoplasmic amount will be increased, nucleus gradually decreases and disappears finally. Staining reaction changes from deep basophilic to polychromatophil and finally the acidophilic. What is the reaction of the healthy bone marrow? A normal, that is normoblastic bone marrow contains 30% proerythroblast plus early normoblast cells and 70% intermediate plus late normoblast cells. How is erythropoiesis regulated, and name the most potent stimulus for its regulation? General factors: hypoxia, most potent stimulus. Effects is mediated by erythropoietin, which is secreted from the kidney. Special maturating factors responsible for final maturation of RBC. It includes dietary factors, helps in the synthesis of hemoglobin. Castle intrinsic factor, IF, produced from the parietal cells or oxentic cells of the stomach, helps in the absorption of vitamin B12 from ileum. Extrinsic factor, vitamin B12 and folic acid. What are the sources of erythropoietin and how it is formed? 85% it is from the kidney, interstitial cells of the peritubular capillaries. 15% extrarenal, that is liver, tissue and macrophage system. Formation: kidney, renal erythropoietic factor produces the stimulus is for this is hypoxia, or hypoxia also stimulates liver for erythropoietin, erythropoietinogen from alpha globulin. Erythropoietin is secreted. Erythropoietin sensitive stem cells produces proerythroblast. What is mode of action of erythropoietin? Potentiate stages of erythropoiesis: increases RBC count in 2 to 3 days, increase release of reticulocytes from the bone marrow, increase hemoglobin synthesis in already existing normoblast. What is a hematinic principle? Casel's intrinsic factor with extrinsic factors forms hematinic principle, which helps in the conversion of a prothroblast to mature RBC. Therefore, deficiency of any one of them causes maturation failure or leads to megablastic anemia. What determines the rate of erythropoiesis? By reticulocyte count, we determine the rate of erythropoiesis. Normally, reticulocyte count will be less than 1%. Why RBC count is less in females compared to males? Due to less androgen in females, because androgen stimulates erythropoietin production. Give physiological basis of anemia in kidney and liver diseases. Both conditions depresses erythropoietin factor formation, so which is required for the formation of erythropoiesis, so decreases in RBC causes anemia. What is the basic morphological classification of anemia? Based on the size of the RBC and its hemoglobin concentration, there is normocytic, normochromic, and normocytic, macrocytic hypochromic anemia. This is normocytic. This is based on the size. This is based on the color. Normocytic, macrocytic, and microcytic, less than normal, more than normal. This is normochromic and hypochromic. Hypochromic color, the central pallor is more than one third. After acute hemorrhage, because normocytic, normochromic, after acute hemorrhage or all hemolytic anemias except thalassemia, aplastic anemia, where there is no protection. Normocytic, hypochromic, after chronic hemorrhage. Macrocytic, normochromic, all megaloblastic anemia due to deficiency of vitamin B12, folic acid, or intrinsic factor. Macrocytic, hypochromic, secondary to liver diseases. Microcytic, normochromic, chronic infections. Microcytic, hypochromic, iron deficiency anemia, and thalassemia. Note, iron deficiency anemia is most common in India. It's a microcytic hypochromic type. What is pernicious anemia or Addison's anemia? Give its major signs and symptoms. Causes: lack of intrinsic factors, failure of absorption of, so it leads to the failure of absorption of vitamin B12. Characteristic features, major signs and symptoms: in bone marrow, megaloblastic hyperplasia, 70% proerythroblast, early normoblast, normal 30%, 30% intermediate, late normoblast, and normal 70%. Blood changes: RBC, macrocytic, normochromic anemia, count will be less, hemoglobin will be decreased, reticulocyte count more than 5%, which usually reticulocyte count will be normally 1%, reticulocyte count is increased to 5%. Changes in GIT, deficiency of intrinsic factor, achloidria, GIT disturbance. Changes in the nervous system, demyelination of the dorsal and lateral column, acute combined degeneration of the spinal cord, tingling and numbness in the limbs, motor and psychological disturbances. Give signs of improvement in pernicious anemia patient after being treated with the vitamin B12. Generalized improvement in health, patient feels stronger. Reticulocytes response, increase in reticulocytes count up to 30 to 40%, usually normally 1% only it will be there. Normoblastic reactions of the bone marrow. Why pernicious anemia is so called? The treatment for vitamin B12 prevents the progression of CNS lesions but cannot reverse the damages already done, and the changes in the stomach remains unaffected. This is why anemia is called as pernicious anemia, that is destructive anemia. What will happen if folic acid is given to the pernicious anemia patients? It will improve the blood picture but cannot protect against the neuropathy. Changes in the nervous system may even accelerate the development of the nervous lesions. What is the commonest anemia in India and why? Iron deficiency anemia. Causes: for decreased intake of iron because of milk-fed infants, increased iron loss because of hemorrhage, increased iron demand during the pregnancy, infancy, and menstrual cycle, and defective utilization of iron due to the decreased absorption in the GIT. Give characteristic features of iron deficiency anemia. RBC, microcytic hypochromic count normal, bone marrow normoblastic hyperplasia, blood serum iron level is decreased, normally it will be 60 to 160 micrograms per deciliter. Total iron binding capacity increases, that is normal 150 to 350 micrograms per deciliter. Nails become dry, soft, spoon shaped with longitudinal striations, tongue angry red, repeated chest infections, dyspnea and palpitations, irritability, loss of concentration, headache, generalized body ache, and impotency. Define jaundice and give its causes. It's a yellowish discoloration of the skin or eyes, sclera, or any other body tissue due to the excessive accumulation of bilirubin in the plasma and the tissue fluids. Normal serum bilirubin is 0.2 to 0.8 milligrams per deciliter. Clinically, jaundice occurs when serum bilirubin is more than 2 milligrams per deciliter. First site, sclera becomes sclera because protein elastin has high affinity for bilirubin. Major types of jaundice with characteristic feature that you will learn in 9.1 page 79. What is physiological jaundice? Appearance in some newborn children on second or third day of life is called as a jaundice of newborn or neonatal jaundice. Jaundice causes excessive destruction of RBC or hepatic immaturity. In infants, when serum bilirubin rises above 5 milligrams per deciliter, it leads to clinical jaundice. What is phototherapy? Exposure of the skin to white light converts bilirubin into lumirubin. which has a shorter life than bilirubin, and it is the value in treating infants with jaundice irrespective of its cause. What are the types of leukocytes and how their normal distribution? Granulocytes and agranulocytes. In granulocytes, we have neutrophils, eosinophils, and basophils. Neutrophils 50 to 70%, whereas eosinophils 1 to 4%, basophils less than 1%. Agranulocytes, lymphocytes 20 to 40%, monocytes 2 to 8%. What is total leukocyte count? That is TLC. Give causes of its variation. At birth, it will be 20,000 per microliter. In adult, it will be 4,000 to 11,000 per microliter. In leukopenia, TLC, total leukocyte count, will decrease as less than 4,000 per microliter. Causes starvation, typhoid fever or enteric fever, viral or protozoal infection, bone marrow depression. Leukocytosis, total leukocyte count increases more than 11,000 per microliter. Causes newborn or in the evening time, exercise, stress or any other epinephrine injection, pregnancy, menstruation or lactation, any pyogenic or pus forming or pyogenic fever producing infection. What is leukemia? It's a cancerous condition of the blood in which total leukocyte count usually increases more than 50,000 per microliter. It is associated with the presence of immature WBC in the peripheral smear. Give functions of various variations in the WBC that you will be studying in this table. Neutrophils, it has two types of functions, that is phagocytosis, and it has endogenous pyogenic phagocytosis is the first line of defense against the bacterial infection, contains endogenous pyogen, mediator of the febrile response. The variations is neutrophilia, when neutrophils are increased conditions. Physiological and pathological conditions are when you do exercise, the neutrophils are increased after epinephrine injection, pregnancy, menstruation and lactation. During these conditions, neutrophilia will occur. And pathological causes, abnormal causes, acute pyogenic or pyogenic infections, tissue restrictions like trauma, surgery or hemorrhage. Neutropenia, decrease in the neutrophil count. In children, normal count will be 40%. Typhoid fever, there will be decreased condition, decreased in the neutrophils. Viral infection or bone marrow depression. Eosinophilia, mild phagocytosis contains enzyme that limits the allergic reactions by regarding inflammatory mediators, example histamine and bradykinin, provide a local mucosal immunity. Eosinophilia, increased eosinophils, allergic conditions like bronchial asthma, worm infestation and skin diseases. Eosinophilia decreased after injection of after injection of adrenocorticotropic hormone or corticosteroids or Cushing disease, you will see decreased eosinophil count. Basophils, mild phagocytosis function and it libers histamine and eosinophils, chemotactic factor for anaphylaxis. Allergic, it leads to the allergic manifestation, example skin reactions to anaphylactic shock, and contain heparin, which is an anticoagulant. Basophils are increased, that condition is called basophilia in chickenpox, smallpox, tuberculosis or influenza infection. Basopenia, decrease in the basophil count after glucocorticosteroid administration or drug induced reactions. Lymphocytes, it produces antibodies, that is immune substances. Increased lymphocytes are called lymphocytosis. Decreased lymphocytes are called lymphopenia. Increase in condition in children, it will be normally 60% count, more than normal count, which is a 40%. This is called relative lymphocytosis. Chronic infection like tuberculosis, lymphatic leukemia or viral infection. Leukopenia, decreased lymphocyte count, that is hypoplastic bone marrow or AIDS condition. Monocytes, active phagocytosis, second line of defense. First line was neutrophils. It entered the tissue and become the tissue from macrophages and kill tumor cells. Monocytosis, increase in the monocytes, tuberculosis, syphilis and leukemia. Monocytopenia, decrease in monocyte count, hypoplastic bone marrow. What are the events during the phagocytosis mechanism by the neutrophil? Diapidesis, motile neutrophils come out from the bloodstream into the tissues. Chemotaxis, bacterial products interact with the plasma protein, attack neutrophils at the site of injury. Opsonization, opsins are IgG group of antibodies against the bacteria. They coat the bacteria and make them susceptible to phagocytes. Phagocytosis occurs at pH 6 to 8, not dependent on oxygen, and neutrophil can phagocyte 5 to 20 bacteria. Degranulation, that is release of defensins bactericidal from the lysosomal granules in the digestive pouches and kills and digests the bacteria. Sharp increase in oxygen uptake, the respiratory burst, and the generation of the superoxide radical O2 minus and hydrogen peroxide radical, both are potent bactericidal agents. Inflammatory response due to the release of lysosomal enzyme histamine and serotonin 5-HT into the extracellular fluid. And then limiting inflammation due to the release of thromboxins, which is a vasoconstriction, and prostaglandin anti-inflammatory effect. Related viva voice questions like define diapedesis, opsonization, define pH at which the phagocytosis is optimal. Next, what is a senile leukocyte? Give its feature. It is an old RBC with poor mobility, few active granules in it. Give normal count and variation in platelets. Normal count is 1 lakh, 1.5 lakh to 4 lakh per microliter. Lifespan is 8 to 12 days. Variations in count. Thrombocytosis and thrombocytopenia. Thrombocytosis is increase in platelet count. Thrombocytopenia decrease in platelet count. Causes for thrombocytosis after epinephrine administration due to the splenic contraction and stress because of trauma, surgery or injury. Splenectomy, removal of spleen. Thrombocytopenia causes bone marrow depression, hypersplenism, dengue, viral fever, a particular attack of platelets, drug hypersensitivity. What is von Willebrand factor? It is a large circulating molecule produced by endothelial cells. It helps in the platelet addition and regulates the circulating level of factor 8. List the functions of platelets. Hemostasis, spontaneous arrest of bleeding by physiological process. Mechanism, event, platelet addition, stick to the exposed collagen, platelet activation, platelet change shape and granulate and stick to each other. This is called as platelet aggregation. Activates phospholipase C and A2, thromboxane A2 plus Step 2, that is blood coagulation, formation of temporary hemostatic plug, and prostacyclin inhibits thromboxane A2 and decreases intravascularization spread of clot. Blood coagulation, fibrin formation, which converts the temporary hemostatic plug into definitive hemostatic plug. Clot retraction, it is produced by the thrombosynthetase actin and myosin in platelets. Phagocytosis of the carbon particles and immune complexes. Storage of serotonin and histamine. Define hemostasis and platelet addition, platelet aggregation and platelet activation, which we already discussed in question 61. How does aspirin helps in preventing of heart attack and the transient paralytic attacks? Aspirin acts by inhibiting thromboxane A2 and the value is preventing heart attack, myocardial infarction and stroke, stroke, that is paralysis, transient ischemic attack. Next, what are the major events which gets involved during the hemostasis? Constriction of blood vessels due to local nerve reflex and release of serotonin and from the platelets, and formation of temporary hemostatic plug, conversion of temporary hemostatic plug into definitive hemostatic plug. What initiates intrinsic and extrinsic mechanism of blood clotting? Intrinsic, activated by the exposure of the blood to the collagen fibers or change in the blood constituents or exposing the blood to the collection of glass slides. Extrinsic activation, activated by the injury of the blood vessels, wall or body tissue. Note, intrinsic system reactions are slower process and take several minutes, 1 to 6 minutes for completion. What is cascade of amplification reaction? The positive feedback reaction. Here small quantities of inactive enzymes are activated, which in turn successively activates increasing quantity of other inactive substances. Why does blood does not clot in circulation? Smoothness of endothelial lining, presence of negatively charged particle over the endothelium which repel the clotting factor, that is proteins, are negatively charged, velocity of circulation, presence of natural anticoagulants in the blood like heparin and protein C, simultaneous activation of fibrinolytic system. What is fibrinolytic system? Factors that initiate the clotting mechanisms also activate an inactive plasminogen in circulation by thrombin and tissue plasminogen activator, that is TPA, released by the tissue damage, thus causing the dissolution of the blood clot. However, this process is much slower than the clotting process. What is physiological significance of fibrinolytic system, or what prevents the spread of clot in injured blood vessels? Prevent excessive fibrin formation and intravascular spread of the blood clot. Human Tissue plasminogen activator, urokinase, streptokinase are used clinically in treatment of the early myocardial infarction and transient ischemic attacks or stroke paralysis. Name natural anticoagulants and their mode of action. Heparin, origin from the liver, first site of isolation, lung, mast cells, and by basophils. Mechanism of action: it facilitates the action of the antithrombin 3, inhibits the factor 9A, 10A, 11A, and 12A. Antithrombin produced by the liver inhibits thrombin formation. Protein C produced by the thrombin by the action of thrombomodulin. It inhibits the activation of factor 5 and 7 for 8. How does dicomarol prevent the blood coagulation? Dicomarol is a vitamin K antagonist. Vitamin K is required for the formation of true thrombin factor 7, 9, 10, and protein C. This inhibits vitamin K antagonist inhibits the blocks vitamin K and then decreases the production of factor 7, 9, 10 and protein C. What are chelating agents? Agents which binds to the calcium used to prevent clotting in vitro, like example sodium citrate and sodium oxalate, sodium EDTA, EDTA ethylene diamine tetraacetic acid. These are chelating agents. Why calcium deficiency does not produce coagulation defect? In vivo, the plasma calcium level is low, less than 5 milligrams per deciliter. To interfere with the blood clotting is incompatible with the life due to the precipitation of tetany. What causes death following a poisonous snake bite? Snake venom causes bleeding due to defibrillation, fibrin destruction produced by fibrinogenopenia and stimulating fibrinolytic system. What is hemophilia A or classical hemophilia? It is a common royal disease due to abnormality or deficiency in the factor 8 inherited sex-related abnormal gene on X chromosome. Females are carriers, males manifest signs of the disease because in the presence of another X chromosome, the defective gene acts as a recessive. Diagnosis: coagulation time is increased, normal bleeding time, clotting time is increased, coagulation time is increased, normally it will be 3 to 8 minutes. Bleeding time is normal is 2 to 5 minutes. Bleeding time is also increased. Is it possible to have a female hemophilic child? If a hemophilic man marries a hemophilic carrier, it is possible. What is purpura and what are its types? How can it be diagnosed? It is a clinical condition in which the defective capillary contractibility results in a bleeding. It is characterized by spontaneous hemorrhage beneath the skin, mucosa, and internal organs. Types: primary and secondary. Primary idiopathic and secondary symptomatic due to the allergies. Primary congenital hereditary usually occurs in children. The secondary due to allergies, infections, or drug. Example: iodine, quinine, and phenothiazine. And cancer diagnosis: clotting time is normal, bleeding time is increased, decreased capillary endothelial resistance, increased capillary fragility. Skin microscopy: in primary purpura, skin capillaries are irregular and disordered. In secondary purpura, capillaries are anatomically normal but they do not contact effectively in response to the injury. Platelet count is normal. What are clinical forms of purpura? Purpura with associated reduction in the platelet count is known as thrombocytopenic purpura. Clinically, it is seen as mild, moderate, or fulminating purpura with a platelet count is less than 50,000 or 10,000 and 1,000 per microliter respectively. Athrombocytopenic purpura with normal platelet count. Blastocytic purpura due to the abnormal circulating platelet but platelet count is normal. What is full description of classical ABO blood group? Give the frequency of distribution in India. A beta, A alpha, A B, and A O alpha beta. Antigen in A beta. A antibody is beta. In this B, it's antigen or agglutinogen is B, and then antibody is alpha. A B, both A and B. Antibodies are nil. O alpha beta. Neither A and B antigen is there, but both antibodies will be present. This distribution is A beta is 21%, B alpha is 39%, whereas AB blood group 9%, O alpha beta is 31%. What is Lanston's law? Give expectation exception of the law. Give exception of the law. If an antigen is present on the RBC of an individual, the corresponding antibody must be absent in the plasma. If an antigen absent in the individual's RBC, then the corresponding antibody must be present in the plasma. Exception to the second part is Rh negative individuals, in whom absence of Rh negative antigen on the RBC is not accompanied by the presence of corresponding antibody in the plasma. Why do classical ABO blood groups first appear in an individual? First appear in the 6th week of the fetal life. When do? First appear in the 6th week of the fetal life as a Mendelian dominant. How does rhesus blood group define Rh positive and negative individual? When the rabbit serum who has been immunized against the rhesus monkey's RBC is tested against the human RBC, agglutination occurs in 85% of the people called as Rh positive, and their RBC contain D-agglutinogen and their serum contain no Rh antibody. No agglutination occurs in 50% with Rh negative whose RBC contain no D-agglutinogen and their serum contains no Rh antibody. Name Rh antigen and antibody. Rh antigen is D and its antibody is called anti-D. How can Rh antibody be produced in Rh negative individuals? Anti-D antibodies in Rh negative individuals may be produced by transfusion of Rh positive blood, that is D positive RBC 0.5 milliliter may be sufficient. Entrance of D positive RBC from Rh positive fetus to the maternal circulation of Rh negative mother. What are the difference between ABO blood group and RS blood group antibodies? These antibodies are alpha and beta in ABO blood group. Here anti-D antibody, that is RH group, in RH group it acts on antigen A and B, it acts on RH antigen. Globulin is IgM type, it is IgG type, so this can cross placenta. This cannot cross placenta because of its larger molecule. It acts between 5 to 20 degrees Celsius and it is called cold antibodies. This acts between the temperature 37 degrees Celsius. This is warm antibodies. What will be the consequences if Rh negative mother carrying a Rh positive fetus? If the mother is Rh negative, then the fetus is Rh positive, if the mother responds by forming anti-D, which in turn which returns to the fetal circulation and tends to destroy the fetal RBC. This is called hemolytic disease. Since such sensitization generally occurs at birth, the first child is usually normal. Forms of hemolytic diseases are hydrops fetalis, fetus is grossly edematous, icterus gravius neonatus, infant born at term is jaundiced with the presence of nucleated RBCs in the circulation. Kernicterus develops when serum bilirubin is more than 18 milligrams per deciliter, damages the basal ganglion. ABO incompatibility rarely produce hemolytic diseases of the newborn. Why? Because alpha and beta antibodies cannot cross the placenta because it is of IgM type. How can Rh hemolytic disease be prevented? Administering the mother a single dose of anti-Rh antibodies in the form of Rh immunoglobulins. Immunoglobulins are anti-Rh gamma globin soon after the childbirth. If mother is Rh positive and fetus is Rh negative, now complications occurs in the mother. Why? Since capacity to make immunoglobulin response to foreign antibodies develop only after birth. Give reasons of blood grouping tests. In the blood transfusion or in pregnancy, Rh incompatibility, investigation a case of paternity dispute, medico-legal value, or blood grouping antigens helps in cell recognition. What basic rules to be observed in blood transfusion? Donor plasma containing agglutinin usually ignored, but it's get diluted in 5 liters of recipient plasma. No Rh negative female at any age before menopause should never be given Rh positive blood transfusion. Then, what is the only safeguard against the blood transfusion complication? What is the direct cross matching? To match the serum of the recipient directly against the RBCs of the donor and again the match of RBCs of the recipient against the serum of the donor, agglutination is either in case indicates incompatibility. In case of extreme emergency, ORH negative should be used. What is autologous transfusion? A patient's own blood can be withdrawn up to 1 to 1.5 liters or 3 to 4 weeks in advance of elective surgery, then refused during the surgery. What are the dangers of blood transfusion? Uh, in inapparent hemolysis, post transfusion hemolytic jaundice, hemoglobinuria, blocks capillaries, violent pain in the chest, back, and dyspnea even after few milliliter of blood has been introduced. Oliguria, renal failure due to the renal tubular damage. Death may occur if more than 350 ml of incompatible blood is transfused. Mechanical overloading of circulation, stored blood RBC, loose potassium, hyperkalemia and death, stored RBC. And then citrated blood transfusion decreases ionized calcium and causes tetany, pyogenic infections, allergic reactions, causes anaphylaxis, transmission of diseases like malaria, AIDS, and jaundice. The term universal donor and universal recipient are no longer valid. Why? As complications can be produced by the existence of RH and other factors, so they are not used. How early as a child's blood group may be set in its true ABO blood group? True ABO blood group is set only as late as 1 year after birth. Can a blood grouping test ever prove that any suspected person in an actual father is an actual father? No. No, that he like many others might have been. Fingerprinting is the great value in determining the paternity in almost 100%. Is almost how much is 1 unit of blood transfusion purposes? 350 ml. What is tissue macrophage system? Why is called so, and what are its function? It consists of phagocyte cells. Example: littoral cells in bone marrow, Kupffer cells in liver and in lymph nodes. Pulmonary alveolar macrophages, PAM, dust cells, osteoclasts in bones, microglial cells in brain, scattered all over the body tissue and together constitute the functional unit tissue macrophage system or reticular endothelial system. Functions: ingest and destroys RBC, ingest bacteria and large foreign particles. Difference between B and T lymphocytes. Population: B lymphocytes is about 20 to 30%, whereas T lymphocytes is about 60 to 80%. Location: in lymph nodes, subscapular region, whereas T lymphocytes in paracortical region or periarteriolar region, whereas it is germinal center and subcapsular region. Lifespan: few days or weeks. It will be 2 to 4 years. Function: it provides the humoral immunity through antibodies formation, major defense against the bacterial infection. Functions of T lymphocytes is to produce cellular immunity response, delayed allergic reactions, rejection and lysis of cancerous cells. And define the term immunity and give classification. Body protection power against the invading organisms is called as the immunity classification. Natural or innate immunity, which is non-specific, or acquired or specific immunity. Natural immunity, again, humoral response or cell-mediated response. Soluble factors in serum on body fluids, example complement system, C-reactive protein and NK cells. Whereas in cell-mediated immunity, neutrophils, macrophages and monocytes. In acquired immunity, humoral response and cell-mediated response. Humoral response: B lymphocytes involved in antibody production, whereas cell-mediated immunity, T lymphocytes encounter grafts and cancerous cells. Difference between the natural and acquired immunity. Natural or innate immune system. Acquired is the immune system. Natural immune system present since birth, whereas acquired immune system acquired after birth, after exposure to microorganisms. Natural immune system is not specific to a particular microorganism, therefore less effective, whereas acquired immune system is specific for each organisms of microorganisms and shows immunological memory, thus more effective. Natural, able to recognize and respond immediately to any foreign particles, whereas acquired action more complex and requires the time for fully development. Natural immune system involves NK cells, neutrophils, monocytes, and macrophages, whereas acquired immune system involves B cells and T lymphocytes. What is the role of natural and innate immune responses in immunity? What is complement system? C-reactive protein, interferons, and NK cells. The complement system contains 11 inactive proteins enzymes. Once get activated, it helps in lysing the foreign invaders by inserting the pore forming molecules, that is perforins, formation of activated fragments 3CA and 35A, inflammatory responses, C5b, C6 and C7 chemotaxis, and C3b opsonization, helps in opsonization and phagocytosis. C reactive proteins. Foreign antigen activates C reactive proteins which coats the invading antigen, which activates the complement system and facilitates the phagocytosis. Interferons. Viral infected cells releases interferons into the extracellular fluid, which limits the spread of infection and inhibits the replication of viruses. Natural killer cells are non-T or non-B lymphocytes, kills cells without any apparent prior sensitization, destroy cells that have undergone malignant transformation, kill antibody-coated viruses, first-line defense against the viral infection. What is the role of an acquired immune system in immunity? It responds for the production of humoral and cell-mediated immunity. Humoral immunity is a type of response involves antibodies, whereas cell-mediated immunity does not involve antibodies. Humoral immunity, major cells involved are B lymphocytes, whereas cell-mediated immunity, major cells involved are T lymphocytes. Functions of humoral immunity: major defense against extracellular bacteria and viral infections that are body fluids. Major defense against the intracellular fungal, parasitic, viral infections, cancerous, and in transplanted organs. Humoral immunity development: lymphocytes precursors from the bone marrow enters the liver and spleen, forming the B lymphocytes. Whereas in cell acquired immunity or cell mediated immunity, lymphocytes are the precursors in the bone marrow. They enter the thymus, forming the T lymphocytes. What is the effect of stimulation of B and T lymphocytes in an acquired immunity? Activated B lymphocytes differentiate to form plasma cells and memory B cells. Plasma cells will secrete antibody, that is immunoglobulins Ig, and which attack the antigens which are get eliminated by phagocytosis. Memory cells will be preserved as the name says, memory cells. Activated T cells differentiate to form helper T cells, that is T4 cells, suppressor T cells, are cytotoxic T cells. T8 cells are memory T cells. First and second, these are precisely regulate the immune response. Third and fourth, responsible for delayed allergic reactions, rejection of transplanted tissues, or lysis of tumor cells. Give the functions of memory cells. Memory B and T cells are readily converted into effector cells by the later encounter of the same antigen. This persistence in the body for months or even during years. What is the role of the thymus in the development of immunity? Via release of thymosin stimulates bone marrow, differentiate of the stem cells into lymphocytes, and migration of lymphocytes into other lymphoid tissues to complete their development. Sensitization of lymphocytes to respond antigenic stimulation, immunologically compete lymphocytes. Name the immunoglobulin and give their functions. IgG, IgA, IgM, IgE, and IgD. IgG has totally 71%, whereas IgA 22%. This IgM is 7%. IgE is a trace amount. IgD is also trace amount. IgG, antibodies of secondary immune response activated by natural infection or immunization, thus produces major antiviral or antibacterial or antitoxic activity in the serum. Can cross the placenta, example Rh antibodies, and promote the activities of WBCs. IgA cannot cross the placenta, provide localized protection by mucosal to mucosal surface. IgM produced primarily due to the primary immune response is of alpha and beta antibodies of ABO blood group. It activates complement system more effective than IgG antibody by lysing cells. In lysing cells. IgE antibody, heat sensitizing antibodies, therefore they are called as regins, plays an important role in allergic, parasitic infection and anaphylactic type of immediate hypersensitive disorder. IgD, it is present in a traces amount present on the surface of B lymphocytes involved in the antigenic recognition. What is major histocompatibility complex or MCH? It is a membrane protein complex on every nucleated cell of the body. It contains antigen receptor, that is T cell receptors, and the protein CD4 and CD8 cluster of differentiation acts as a co-receptors. What is primary and secondary antibody response? Primary antibody response and secondary antibody response. Primary antibody response, initial or first time response for invading organisms, whereas secondary antibody response due to the repeated exposure to the same antigen. Primary antibody response, onset slow to begin, whereas secondary antibody response is fast by memory B cells. Primary antibody response, duration of affection few weeks to decline rapidly, whereas secondary antibody response few months to years and decline slowly. Primary antibody response, primary antibody level, antibodies levels will be low, whereas secondary antibody response markedly increased. What is immunological tolerance or recognition of self, or why we don't usually make a hemoglobin response to our own proteins? The capacity to make a hemoglobin response to the foreign antigen develops after birth. All potent antigens during the period of immunological immunity are recognized as self, and after this period they are recognized as not self. Why do some individuals are more susceptible to infection? This may be due to the genetic tendency for pure immune response. What is autoimmunization or autosensitization? Production of antibodies against the animal's own tissue. These antibodies are called autoantibodies. What causes autoimmune diseases? This is due to the deficiency of the suppressor T cells. Give some examples of autoimmune disorder. Autoimmune disorders, autoantibodies are formed against in insulin dependent, that is type 1 diabetes. Pancreatic antibodies are formed against pancreatic islet cells, that is beta cells. In myasthenia gravis, it is against the nicotinic or cholinergic receptors. In multiple sclerosis, it is against the myelin basic proteins. In Hashimoto thyroiditis, thyroid gland cells. In Graves disease, that is hyperthyroidism, TSH receptors against TSH receptors. In rheumatoid arthritis, it against the collagen tissue. Antibodies are formed. What is immunological surveillance and how it is carried out? When a normal cell transforms into cancerous cell, it displays unusual surface components called as tumor antigens. It is if the immune system recognizes the tumor antigen as a non-self, and it can destroy any cancerous cells carrying the antigen. Such immune response is called immunological surveillance. It may help to prevent the development of cancer. This is carried out by the cytogenic T cells, macrophages, and NK cells. What is physiological basis of chronic lymphatic leukemia? It is due to the uncontrolled proliferation of B cells and the active lymphatic leukemia due to the T lymphocytes malignancy. What causes the acquired immune deficiency syndrome or AIDS? It is caused by HIV immunodeficiency virus. HIV can bind to CD4 cells, decrease or loss of helper T cells, T4 cells, failure of proliferation of T8 cells and B and L lymphocytes, loss of immunological function, and death from infections or cancers. Which type of immunity is lost in AIDS patients? Acquired immunity or cell-mediated immunity is lost in AIDS patients. Which type of T cells participate in both cell-mediated and antibody-mediated immune response? Helper T cells participate in both cell-mediated and antibody-mediated immune system. Important values to remember from the blood physiology. Total blood volume is 5 to 6 liters, that is 8% of the body weight, or 80 ml per kg of body weight. Plasma protein 6 to 8 grams per deciliter. Serum albumin 3 to 5 grams per deciliter. Serum globulin 2 to 3 grams per deciliter. Fibrinogen 0.3 grams per deciliter. Ag ratio, albumin globulin ratio is 1.7:1. Prothrombin 40 milligrams per deciliter. Capillary wall, colloidal osmotic pressure in capillary wall. Colloidal osmotic pressure exerted by the protein is 25 to 30 milligram per deciliter. Hydrostatic pressure at arterial end it will be 37 milligram per deciliter. Venous end it will be 15 milligrams per deciliter. Hemoglobin at birth it will be 23 grams per deciliter. At the end of the 3 months it will be 10.5 grams per deciliter. At the end of 1 year it will be 12.5 grams per deciliter. In adults, male 14 to 18 grams per deciliter, average 15.5. Whereas in females 12 to 15.5 grams per deciliter, average it's 14 grams per deciliter. Clinically 14.8 grams per deciliter is 100% hemoglobin. Oxygen carrying capacity of the blood in males is 21 milliliter per deciliter, when females 18 milliliter per deciliter. 1 gram of hemoglobin when fully saturated combines with a 1.34 oxygen. HbF fetal hemoglobin at birth it will be 80%. At 1 year of age it will be less than 1%. Starts disappearing after 2 to 3 months. Postnatal lifespan of an HB hemoglobin HbF hemoglobin is 80 days, then compared to HbA, which is 120 days. RBC lifespan 120 days, count at birth 6 to 7 milligrams per million per microliter. In adult male it's 5 to 6 million per microliter. In adult female it's 4.5 to 5.5 million per microliter. Serum albumin 2 to 0.8 milligrams per deciliter, more than 2 milligrams per deciliter. It is known as clinical jaundice. WBC granulocytes, neutrophils is 50 to 70%, eosinophil 1 to 4%, basophil less than 1%, granulocytes, lymphocytes and monocytes, lymphocyte 20 to 40%, whereas monocytes 2 to 8%. Total leukocyte count at birth it will be 20,000 per microliter. In adult 4,000 to 11,000 per microliter. Platelet count is 1.5 to 4 lakhs per microliter. Lifespan of platelets is 8 to 12 days. Bleeding time is 2 to 5 minutes, whereas clotting time is 3 to 8 minutes. Blood group frequency of distribution in India. ABO blood group. A blood group is 21%, B is 39%, AB is 9%, O is 31%, RH positive is 85%, negative is 15%. Lymphocytes. B and T lymphocyte population 20 to 30%, whereas lifespan few days or weeks, whereas T lymphocytes population is 60 to 80, lifespan is 2 to 4 years. This is all about the blood physiology important questions. If you find this video helpful, please like, share and subscribe to my channel. If you have any suggestions, let me know in the comment section. Thank you.